MOXI procedure. And MOXI is a laser that resurfaces your skin. It helps with pigmentation and redness. It can help with tightening, and it can get rid of early skin cancers. Another great thing about MOXI is there's not quite that much downtime. I mean, there's not no downtime like BBL. But MOXI has 1 or 2 days of downtime, but less than a halo procedure. So MOXI is especially good for younger people and people that don't have downtime abilities. So we like to combine it often with BBL. We can combine it also with halo. So you could potentially do a BBL MOXI halo. But typically people will do 1 MOXI a month for 3 months. And then they'll usually do 3 more BBLs after that and 1 big halo a year. So it is a great treatment if you want minimal downtime, but you still want some resurfacing. And when I say downtime, what I mean with downtime is that you'll get a little bit of swelling and then you'll get some brown spots that come out, and we love that because we like to get rid of some old skin. Just exfoliate the heck out of skin. And then it does leave your skin looking really good and glowy, which is, we always love some glow. Who's a candidate for MOXI? Everybody can be a candidate for MOXI. MOXI is actually our go-to for melasma patients. Sometimes, though, if you have real dark skin and melasma, often we will pre-treat with some lightening agents first, just to make sure the pigmentation, there's not a chance for you to become hyperpigmented. So depending on your skin tone and depending on what we're treating, we may pre-treat, but everybody's a candidate for this treatment. So if you want to find out if MOXI is right for you, follow us on Instagram, Facebook, or just find us online at RejuvenationMD.com.